Welcome to High-Powered PEMF. We are excited that you have chosen our PEMF technology to help take control of your health and wellness. By using this exciting technology, it's our desire that you will experience a healthy and more productive lifestyle. We've produced this video to help you get started with PEMF basics. As you use your device, you'll become more comfortable with the settings and coil attachments, how to place them on the body, and what results may occur. PEMF is a safe, pleasant, and effective modality to add to your healthcare and wellness routine. However, we are not licensed medical professionals, so if you have medical conditions currently requiring management from the medical community, we recommend consulting your physician before using PEMF. There are educational materials which are available beyond the scope of this video and will prove beneficial in using the device to its full potential. Connecting and turning on your device. Be sure you do not have your car key, credit cards, cell phone, or any electronic devices closer than 18 inches to an attachment while pulsing. Use a surge protector to protect from voltage spikes in the line. It should have a low clamping voltage rated for 1,000 plus joules and 15 to 20 amps. Always connect an attachment before turning on the device. Always turn off the device before disconnecting an attachment. Be sure to place the device in a location that protects it from damage to hot, cold, or wet. Selecting an attachment. Select the attachment depending on the part of the body to be treated. If the goal of the session is overall maintenance, relaxation, and wellness, choose the largest mat or loop available. In a smaller area of the body like a foot, the paddle or small loop would be a better choice. How will PEMF be applied? You can place a body part through, within, or in between the loops of the double loop attachment. The loop or mat can be placed against the user or manipulated to target the desired area. Selecting the intensity level will differ with the type of device you use. Always remember that PEMF should never be painful. If it is painful, the setting is too high and needs to be lowered, or the session should stop until the source of pain is discovered. Digital devices have preset intensity levels with the up and down arrows for selection. Spark chamber devices have a rotary control. Turn the control clockwise to reduce intensity and counterclockwise to increase the intensity. Some users might be initially anxious about the feel of the pulse. If the user has not experienced PEMF before, allow them to hold it in their hand at first. Turn the device on with the intensity low to initially allow them to feel the pulse. Once they realize it's not painful or shocking, the intensity level can be increased. Select the time and slowly increase the level of intensity to a pulse that is comfortable. Use caution when applying PEMF to the head, large muscle groups, or areas with excess inflammation. Also use caution and possibly refrain from using PEMF in the event the user is pregnant or has chances of internal bleeding. Users should also take into consideration any medications being given. PEMF makes everything more bioavailable. Medicines appear to have stronger effects and be more effective. Results, of course, will vary depending on the individual. Different parts of the body are more or less sensitive to the magnetic pulses. Adjust the device to the user's level of comfort on each different part of the body. Here are some recommendations for your PEMF session. Once the attachment has been selected, the power cord properly connected, and the device turned on, begin the session. Every user will develop their own routine. The following is just a suggestion of how to get started. Pulse the area of the lower neck, shoulders, and back first. Next, assuming the user is comfortable, move up the neck to work in the head, TMJ, hyoid, and cranial base. Then move to the lumbar spine, sacroiliac joint, hip and hip flexors, pudendal area, and pelvic floor. Hamstrings, glutes, quads, knees, calves, ankles, and feet will all benefit from PEMF. The single loop works very well for the neck, chest, back, hip, glutes, and quads. The smaller butterfly attachment works well on the head, shoulders, elbow, hand, knee, calf, ankle, or foot area. The 12-inch by 24-inch mat works well for things like head and neck, shoulders, thoracic, spine, lumbar spine, hip, and SI joints. The 18-inch by 24-inch mat works better for the following regions of the body. One could address the thoracic area, the abdominal lumbar area, or the extremities. The 6-foot mat could be used to address the front of the body, then the back of the body. The paddle works well on the feet, deep neck or lung issues, hip joint, or any area lending itself to concentrated PEMF. The long rope is very versatile and is limited only by the imagination. Another way to utilize PEMF is for stress relief. When 2 coils are being used to treat the patient simultaneously, one of the coils must be turned back and forth to determine which way has a stronger or weaker sensation. The positive one will give you a more pronounced sensation. The amount of time spent in one area will vary from person to person and session to session. The therapeutic benefit on tissues is 2.5 to 3 minutes in one area per session. The frequency of sessions will be dictated by the desired outcome, targeted issues, and economy. A general guideline to treating chronic issues is that they may require continued use to resolve. Acute issues require more intense, short-term intervention. For example, the best regimen for an arthritic joint might be to utilize PEMF 10 minutes in the morning and 10 minutes in the evening every day. That's not always economically nor geographically feasible. Another concept to keep in mind is that targeted sessions are not as effective if there has not recently been a full body session. A full body session every 3rd day with targeted sessions every day in between is a good starting place. Here are the characteristics of our PEMF devices. All of our devices are considered high-power, low-frequency PEMF. The digital devices have an additional low-power therapy running at the same time. This is one of the unique features of our machines, and it's unlike any of the other low-powered PEMF devices on the market, which operate at Schumann resonance 7.83 Hz. The digital devices have selectable intensity levels, and the spark chamber devices have a continuously adjustable rotary control for selecting intensity levels. Both digital and spark chamber have timer selections. The higher the intensity a device is capable of generating, the more immediate the results will appear when deeper penetration is required. The devices that generate less intensity are still considered high power in the industry and just as effective in healing and regeneration. We welcome you into the spectacular world of health, wellness, and performance. This cutting-edge technology can change your health, wellness, and overall functionality.